to the Health Zone. I am Dr. Toju Chikiobi, but everybody calls me Dr. Toju. On today's episode of the Health Zone, we will be talking about stroke. Our guest on today's episode is Professor Franco Gini, who's a consultant neurologist. He has a special interest in stroke, and he'll teach us everything we need to know about stroke today. We're going to learn what stroke is exactly. We're going to learn how to recognize it, how to treat it, and how to prevent it. So please don't go away. Join us on the show. Come with me, and let's learn together. Welcome to the Health Zone. Today we have with us in the studio Professor Frank Ogini. Professor Frank Ogini will be talking to us about stroke. He's actually a professor of medicine at the University of Lagos Medical School, the College of Medicine of the University of Lagos, and he's an honorary consultant neurologist for the Lagos University Teaching Hospital. He has a special interest in headache and stroke. So he truly is the expert on the subject, and we are so thrilled to have him with us in the studio today. Professor Ogini, welcome to the Health Zone. It is really, as I said, it's a thrill to have you with us. I can't wait to have you tell us everything that there is to know about stroke. Welcome to the show.
Thank you. It's a pleasure to be here.
Well, you know what? We have a custom here on the Health Zone, and what we do is before we get into the body of the talk, we go out to the man on the street to find out what they know about stroke, because it's really interesting. We're trying to educate the public. So we first want to know, well, what do they know? What are the gaps? And so we're going to take a moment now. We'll go out to the man on the street to find out what they tell us is stroke, and then we'll come back to the studio. Is that okay?
That's fine.
Okay, so we're going to take a short break now and go out to the man on the street and see what men and women know about stroke, and then we'll be right back. Don't go away. Join us.
Welcome to another segment of Man on the Street on Health Zone. My name is Hanifat, and today we'll be going on the streets to talk to people about stroke.
Stroke is a medical name for an advanced high blood pressure.
Well, for me, I don't know much about it.
Well, the little information I know about stroke, it all depends on what individual takes. And what you take sometimes might be something that will affect you now or later in future when you, as you are growing.
Stroke is stress. Stroke is from stress that leads to stroke.
Restlessness. You don't sleep at night. You are tensed up. You are easily agitated. Those are the symptoms of stroke.
Sorry, I don't know much, but
The shortage of blood in the blood, in the system. When you start feeling shortage of blood, maybe you start feeling weak.
One, you have to do a lot of exercises. You diet.
when you need to consult an expert, specialist, when I say expert, somebody, a medical practitioner who can easily give you an advice on what you need to take so that it won't lead to stroke.
Thank you for staying with us on Health Zone for this week. Like you've heard people talk about stroke and what they know about stroke. Now let's go to Dr. Toju in the studio as she tells us the real deal about stroke.
Welcome back to the show. That was really interesting. It's fascinating to know what people really think about stroke. We have a lot of misconceptions about stroke, right?
Yeah.
So hopefully you'll clarify them for us today. So you're the expert. Tell us, what is stroke?
Well, stroke is the term used to describe the rapid onset of disturbance of function of the brain. usually manifesting as a sudden loss of function of one or more body parts, depending on which part of the brain is affected. Okay. Actually, the sudden manifestation was what gave rise to the term stroke.
Okay.
Yes, and these days we also use the term brain attack, also to signify that it's a sudden thing and it's something that should be taken seriously, just like a heart attack.
Okay. So what actually causes a stroke?
Well, there are two types of stroke.
Okay.
Okay, there's one where there's a blockage of blood flow to the brain.
Okay.
That leads to what we call an ischemic stroke.
Okay.
Or thrombotic stroke is also called. Then there's a second type where what you have is a rupture of the vessel supplying blood to a part of the brain, so that there's bleeding into the brain. Okay. That is called hemorrhagic stroke.
Okay, so those are the two kinds of stroke.
Yes.
Okay, now is there anything that predisposes somebody to stroke? Who's at risk for stroke?
Well, actually, age can be said to be most important factor.
Okay.
Because as you get older, your risk for stroke increases. Okay. And stroke is far more common in those, say, above 60 years than in those younger. But as you know, we get older, all of us, so there's really nothing one can do about that. Yes. But the single most important modifiable factor, that is a factor that we can do something about, is high blood pressure.
Hypertension.
Hypertension.
Wow.
Yes. Hypertension is the most significant risk factor for all types of stroke. The hemorrhagic, the different types of hemorrhagic, and also the ischemic stroke. Okay. Now, there are other risk factors. Blood sugar problem, we call diabetes, is also a risk factor. Okay. You also have cholesterol or lipids generally. High levels of lipids or cholesterol is also a risk factor. Then there are some lifestyle habits, if we call them that, that can also be a risk factor for stroke. Okay. And a significant one is smoking. Okay. Cigarette smoking is a risk factor for stroke. Okay. Lack of exercise really can also, or sedentary activities, this usually keys into other things, can lead to increased BP, blood pressure, and so on, and obesity. Okay. So these are things that people can do something about, and that are also risk factors for stroke.
So given the fact that we now know that high blood pressure is the single most important risk factor, so address that issue of stroke is only for old people.
No, stroke is not only for old people. Like you said, it's more common in the old, in the elderly. However, stroke can occur even in children. There are certain types of stroke that occur in children who have sickle cell disease, for example. Right. Yes. Or there's some children that are born with some defects in their blood vessels. Mm-hmm. Like I said at the beginning, stroke has to do with the problem with the blood vessels to the brain. Yes. So some individuals are born with problems in these vessels, and this can lead to rupture.
Okay. Well, it's interesting that you say that, and I'm glad, you're addressing this issue of stroke only happens in the elderly, because later on in the show, we're going to interview a young man who actually had a stroke before the age of 40. He was 39 when he had a stroke. So absolutely. So people really need to know that stroke is not just something that happens, in the elderly. That's great. I'm glad we've cleared that. So we're going to take a break now. Please don't go away. When we come back, we'll be talking about what we can all do to prevent stroke. Stay with us. Welcome back to the Health Zone. Today we're talking with Professor Ojini about stroke. So Professor Ojini, my next question for you, what are the symptoms of stroke? Because that was also something very interesting that we heard on the man on the street. We heard all kinds of things when we asked them the question, what are the symptoms of stroke? So you tell us, what are the symptoms of stroke? How do you know you're having a stroke?
Okay. First, the symptom the person will present will depend on which part of the brain is affected by the stroke process. Yes. Okay, so it depends on the loss of function of that part of the brain. Yes. Okay, so it can vary, but there are certain typical presentations.
Okay.
The one that well, I guess many people will know about is paralysis.
Yes.
Okay, and it's usually paralysis or weakness of one side of the body. The arm, the leg, and even the face, usually on the same side. But stroke presentation goes beyond that. Stroke can also affect speech. Speech in terms of the use of language. Person is unable to understand speech, spoken speech, and the person also has a problem speaking.
Yes, so the expressive language is also affected.
Exactly,
yes.
Expressive language and what we'll call receptive
yes.
language.
Yes.
Okay. Now, stroke can also affect thinking, what we call cognitive functions, your ability to think, to reason. Okay, you just find a situation where the individual is not thinking properly anymore.
Yes.
Okay, that can be a manifestation of stroke. Okay, actually, there's an acronym we are promoting now to improve awareness of stroke manifestations. It's called F.A.S.T. Okay,
F.A.S.T.
F.A.S.T.
Mm-hmm.
F stands for face. You look at the face, and if you notice that the face is drooping, that could be a sign of stroke. Then A is arm. Okay, that asks the individual to raise the arms, usually both arms, and you may find that one arm begins to droop or to drift, we call it. That is a sign of stroke. Mm-hmm. Then speech. Listen to him, that's the S. Listen to him or her speak, or say some short phrase and ask the individual to repeat. And if you notice slurring, then that is a sign of stroke. Now, the T there really is time. T for time. It's just to tell you that time is of the essence.
This is an emergency.
It's an
emergency. Something
emergency.
right away. Get them to the hospital.
We also say that time is brain in stroke.
Yes.
That is, the longer the delay, the more damage is done to the brain.
Okay.
I would like to talk about something that can happen to individuals before they actually have a full stroke.
Okay.
Okay. We call this a transient ischemic attack. This is a situation where you have a sudden loss of function. Could be drooping of the face, could be paralysis of one side, but which is very transient. Usually goes within an hour. In fact, by definition, 24 hours is allowed.
Yes.
Okay. Now, it's some people call this a mini stroke.
Yes.
Technically speaking, it's not really a stroke.
Yes.
Okay. But it's the same underlying process.
Yes.
So it's actually a warning sign to that individual that a stroke can occur anytime.
Yes.
So it's something that should be taken seriously.
Okay.
So it's not just, don't disregard it.
Yes.
If you have a try, even if it's transient, you notice a sudden weakness of one part of your body, disappears within hours, you should still go to the hospital. Yes, you should.
Okay.
Yes, because that could be a warning sign for a stroke.
Okay. All right, that's good. Well, on that note, we'll now talk about prevention of stroke, because we know that the reality in sub-Saharan Africa is that it's unlikely we're going to get to help on time, that we can even recognize it, that we can have the right skilled help that we need. And so I want us to talk about prevention, but we'll hold that for a second and we'll take a break and come right back. So we're going to take a break now. Please don't go away. When we come back, we'll be talking about what we can all do to prevent stroke. Stay with us.
Go back on a particular Saturday evening from my sister's wedding, and I slept only to wake up. I was tired that night. I noticed I was unusually tired. Only to wake up in the morning, I wasn't feeling a particular part of my body.
What part of you?
My left-hand side.
Okay.
I couldn't feel my part of my body. My wife tried to wake me up. Today's Sunday, we need to go to church. I said, okay, I'll get up in some few minutes. But I noticed that every time I speak, I wasn't hearing myself clearly. The speech was a bit slow. So I drove the car. I noticed as I was driving, the car was tilting towards the side. My son was shouting, Dad, you're going to run into a car. So I stepped on the brake. But like I said earlier on, in my mind, my leg has moved, but my leg actually didn't move until I ran into the car. While I was home, somebody came to check on me, one of the medical personnel in the church. She came to check on me. She noticed some things I didn't notice because then I had not checked the mirror. So she ran back, called another male pastor, and so they came home and she said, I must go to the hospital. In my usual self, it's just tiredness. Maybe I'll be over with this and stuff. Well, I ended up in a particular hospital. The doctor said, go back home, it's just malaria. The lady insisted you go to general hospital. Actually, Lut, we went to Lut, and then when we got to Lut, the doctor said, you're coming down with stroke. Stroke, 39. What that stroke? Then the usual understanding is that stroke is meant for people in their 80s, 60s, 70s. So I began to feel my body. I wasn't actually feeling the body. I knew it was there, but not the normal feel. I noticed that one part of me was weaker than the other. So that's why I was admitted at Lut for some 20-something days.
Wow. So with all you know about stroke now, what would you tell somebody else to help them prevent something similar happening?
I think lifestyle is the most important thing. Change your lifestyle, watch your diet. And no matter what your age is, there's a particular field around my area. On Saturday, I went there to play football because I told you must be active. Yes. So you can walk, park the car sometimes and take a stroll, walk in the night, but cut down your food. And to people who work late till the night, please, late night food is not... I'm still battling with that anyway. I'm not saying I'm totally out of it, but you need to watch. It's just basically about lifestyle and making smart choices. Yes. Just that. In the present day we're in, it can happen to anybody. So whether you're a child, an adult, you need to watch what you eat now, not when it happens now. And if you have come down with stroke or any symptom of stroke, it's still possible to recover fully. Yes. It is still possible. There was a time I couldn't use any part of my body, but now fully recovered. But it has to do with full determination, encourage yourself, and please listen to your doctors. Even though you don't like them, you don't like the prescription, but listen to the doctors, and I think you're good to go.
Welcome back to the Health Zone. Today we're talking with Professor Ojini about stroke. So, Professor Ojini, how can we prevent stroke?
Okay. You know, generally in medicine, we say prevention is better than cure.
Absolutely.
That is what we say.
Everybody knows that, yes.
But stroke is one condition where this really holds true.
Yes.
So the best way to manage stroke is really to prevent it. Yes. Really. And that is why prevention is key. We've identified the major risk factor for stroke, which is hypertension, major modifiable risk factor.
Yes.
Because age is a risk.
You can't modify that. Black race, you can't modify that.
Yes, it's a good thing you mentioned because race is also a risk factor.
Yes.
It's commoner in the blacks. And that also apparently is because hypertension is more prevalent in blacks, yes. Especially severe hypertension.
Yes.
Okay, so hypertension, blood pressure. So you need to know what your blood pressure is. So you need to have your blood pressure checked. Yes. And if you are hypertensive, you have high blood pressure, then you need to stay with your doctor, partner with your doctor to control your blood pressure. So one needs to have regular BP checks. If your BP is normal, well, depending on your age, even if it's just an annual BP check, that may be all right. Yes. But if you have high blood pressure, then at least checking your blood pressure every month, once a month, it should be done. Yes. We also advise that if you can afford it, you get
a small cough at home.
Yes. And monitor your blood pressure yourself. Yes. You don't have to do it every day. Yes. Once a week probably will be adequate. And then you must take your medication if you are hypertensive. Take your antihypertensives. Then diabetes. Yes, if you are diabetic, that has to be treated. Diabetes has its own complications apart from stroke and other things. So you need to make sure that your blood sugar is properly taken care of. And then your lifestyle will should change, healthy habits. Yes. Cigarette smoking is a no-no for several reasons, really. Okay, but in stroke, no smoking, not one stick in a month, no.
All right. Wow, this has been really, really informative. Thank you so very much, Professor Ojini, for joining us in the studio today to teach us all about stroke. We've all learned quite a bit, and I hope you'll come back again and talk to us about other things, because there's so much we need to learn.
Welcome.
So it's a pleasure to have you here on the
myself
show.
and,
Thank you for coming.
Very welcome.
So now, don't go away. We're done with Professor Ojini, but I'm going to recap really the high points of some of the things he said that we need to remember about stroke. And so I'll be right back and we'll talk about those. Don't go anywhere. Welcome back to the Health Zone. We have just been talking with Professor Frank Ojini about stroke, and we've learned quite a bit. So I'm going to just recap the main things that he said. The number one thing he said is that the single most important thing you can do to prevent stroke is to know your blood pressure and keep it under control. But if you are diagnosed with blood pressure, you have to get your blood pressure checked at least once a month. He said if you can afford to, get a small blood pressure kit yourself so you can check your blood pressure frequently. The other thing Professor Ojini mentioned is the acronym F.A.S.T. F.A.S.T is the way to recognize somebody having a stroke. F stands for facial droop. A is for arm drift, if the arm is weak and is drifting. S is for slurred speech. And T just simply means time is of the essence. Get that person to health care immediately. Lastly, he talked about the most important things we can do to modify the risk factors for stroke. The main risk factors, of course, are high blood pressure and diabetes. So making sure that if you've been diagnosed with those, you're taking your medication regularly, and then you make aggressive lifestyle changes to prevent having high blood pressure, to prevent having diabetes, or to keep them under control if you have them. And these, of course, include managing your weight, keeping it under control, making sure you're active every day, making sure that you're eating healthy, and making sure that you're limiting alcohol, and if you smoke, stop smoking entirely. It's been terrific having you with us here on this episode of The Health Zone, where we have learned quite a bit about stroke. Do join us again, and this is Dr. Toju saying, stay healthy.